Morning, everybody. My topic is Guillain-Barre Syndrome associated with SARS-CoV-2. Presentation. My university and my name, Boris Jose Mendoza Menendez, and my social media. Definition. Guillain-Barre Syndrome is a rare disorder in which the body immune system attacks the nerves. The first symptoms are usually weakness and tingling in the extremities. This sensation can spread quickly and eventually paralyze the entire body. In its most serious form, Guillain-Barre syndrome is a medical emergency. Most people with this condition must be hospitalized for treatment. The exact cause of Guillain-Barre syndrome is unknown, but it is often preceded by an infection disease like a respiratory infection or stomach fluid.
This is Ned the Nerd. He might look a little funny, but he has a very important job to do in your body by helping your muscles move when you want them to. But sometimes your muscles don't move when you want because of a nerve injury or disease. One disease that can do that is Guillain-Barre Syndrome. We just call it GBS for short. Maybe someone you know has been diagnosed with GBS, or maybe even yourself. If so, you probably want to know more about GBS and how it involves nerves like Ned. First, more about Ned's job. Nerve cells, or neurons, send and receive messages to and from your body using electrochemical impulses. The nerve cells involved in your peripheral nervous system, which controls the ability to feel and move, have extensions called axons that can be several feet long and are covered in a fatty coating called myelin. You can think of myelin like the insulation around an electric wire. It helps to speed transmission of messages along the nerves and make sure that the messages get to the right place at the right time. But with GBS, the myelin coating around the nerves is damaged and removed, which stops the nerves from delivering their messages properly. The first signs of GBS are often a weakness or tingling in your legs. Think about it. The nerves in your foot extend all the way up to your brain. There's a lot of places for a message to get lost. As GBS progresses, numbness and weakness usually spreads up your body, and in some serious cases it can affect your breathing and facial muscles as well. Doctors will have to run a few tests to confirm if you have GBS, including a lumbar puncture and an EMG. Plasmapheresis and IVIG are often helpful to shorten the course of GBS and limit nerve damage. The acute phase of GBS typically varies in length from 4 to 6 weeks, with over 90% of patients moving into the rehabilitative phase within 4 weeks. You might be wondering how you got GBS in the first place. The truth is, doctors aren't 100% sure what causes GBS. But we do know that 60 to 80% of cases are preceded by some sort of bacterial or viral infection like the flu or food poisoning. Because of how GBS works, it isn't hereditary or contagious, so you don't need to worry about passing it on to your friends and family. Also, GBS has a very low mortality rate, and 95% of patients recover to varying degrees from it. The chances of getting GBS again are the same as getting GBS in the first place, about 1 in 100,000. Recovery from GBS may take 6 months to 2 years or even longer, and many patients continue to have long-term recurrences of fatigue and/or exhaustion, as well as pain, numbness, and muscle aches. However, there is life after GBS, and the GBS CIDP Foundation International is committed to supporting you.
Application in medicine. Symptoms: tingling and prickling sensation in the finger, toes, ankles, and wrist. Weakness in the legs that extend to the upper body. Unstable gait or inability to walk or climb the stairs. Difficulty with eyes or facial movement, including talking, chewing, or swallowing. Severe pain that can feel like itch or cramps and can get worse at night. Difficulty controlling the bladder or bowel function. accelerated heart rate, high or low blood pressure, and difficulty breathing. With respect to causes, the exact causes of GPS syndrome is unknown. That disorder usually appears days or weeks after a respiratory or digestive infection. Rarely recent surgery or vaccination can trigger GPS. Recently, some cases have been reported after Zika virus infection. In GPS, the immune system, which generally only attack invading organisms, began to attack nerves. In EADP, the most common form of GPS in the United States, the protective covering of the nerves, myelin set, is damaged. The damage prevents the nerves from transmitting signal to the brain, causing weakness, numbness, or paralysis.
Guillain-Barre Syndrome is a rare medical disorder in which the body's immune system mistakenly launches an attack on the peripheral nerves. The attack is mainly targeted at myelin, which forms the insulating layer around the axons of neurons and helps to prevent electrical signals from decaying due to leaking out. When the myelin sheath is damaged, nerves are not able to conduct electrical impulses normally, and, in case the damage is severe, the underlying nerve can even die. It is an autoimmune condition which is typically triggered by an infectious illness, such as the stomach flu or a lung infection. The exact underlying cause is still under surveillance. It is believed that structural resemblance between the attacking microbes and some molecules in myelin fools the immune system, and the immune system starts attacking body's own nervous system. The syndrome may be triggered by infection with Campylobacter, influenza virus, Epstein-Barre virus, cytomegalovirus, Zika virus, hepatitis virus, HIV infection, and mycoplasma. In some instances, increased risk has been observed with surgery, Hodgkin's lymphoma, and rarely with influenza vaccinations or other childhood vaccinations. Symptoms usually start as weakness in the feet and legs that gradually spread to the upper body. Tingling or pins and needle sensations also qualify for the first symptoms and usually involve the fingers, toes, ankles, or wrists. There may be difficulties with eye or facial movements, such as blinking, chewing, laughing, swallowing, or speaking. Gradually, with more damage to the nerves, patient develops unsteadiness while walking or inability to walk or climb stairs. Patient can complain of easy fatigability and severe pain that may be worse at night and crampy or achy in nature. It is seen that most significant weakness is experienced within 2 to 4 weeks after symptoms begin. Patient may also experience difficulty with retention of urine and sluggish bowel movements. In addition, rapid heart rate, difficulty breathing, and wide fluctuations in blood pressure can also be seen. Guillain-Barre syndrome can cause weakness or paralysis of the muscles that control the breathing. Up to 30% of people with this syndrome need breathing assistance from a respiratory machine during their hospitalization. Due to long-standing immobility, these patients are at risk of developing blood clots. Being immobile also puts the patient at risk of developing bed sores. Around 3% of the patients experience a relapse. Guillain-Barre syndrome can be diagnosed by a careful medical history through physical examination and certain tests. Spinal tap can be done to withdraw a small amount of cerebrospinal fluid, which is then tested to make the diagnosis. Electromyography is a helpful test in which thin needle electrodes are inserted into the muscles to measure nerve activity. Nerve conduction studies are conducted to establish the diagnosis. In this test, some electrodes are taped to the skin overlying certain nerves, and then small electric shock is passed to measure the speed of nerve signal. Guillain-Barre syndrome does not have a sure-shot permanent cure, but treatments are there to speed up the recovery and reduce the severity of the symptoms. Plasma exchange, or plasmapheresis, can be done in which the plasma, which is the liquid portion of the blood, is separated from the blood cells. This process eliminates certain antibodies present in plasma that contribute to the immune system's attack on the nerves. Immunoglobulin therapy is a promising treatment in which healthy antibodies are transfused to the patient, which block the action of those antibodies that mediate the damage in Guillain-Barre syndrome. It is essential to give respiratory support when needed, manage pain control, and prevent formation of blood clots.
The standard of care includes physical therapy, training with adaptive devices such as wheelchair, and assisted or independent movement of the arms and legs to keep the muscles strong and flexible. Training and development of self-care skills plays a significant role in the overall treatment plan. Among adults recovering from the syndrome, about 80% can walk independently 6 months after the diagnosis, and about 60% undergo full recovery about 1 year after the diagnosis. For more information about
GBS can be triggered by the following reasons. Most often, infection with Campylobacter of type of bacteria found frequently in undercooked poultry, influenza virus, cytomegalovirus, Epstein-Barr virus, Zika virus, hepatitis A, B, C, and E, HAV, the virus that causes AIDS, Mycoplasma pneumoniae, surgery, Hodgkin lymphoma. In a report published in the online edition of the New England Journal of Medicine, the authors say that between February 28 and March 21, 3 local hospitals treated about 1,200 patients showed symptoms which were most likely caused by GBS. The team said GBS tend to appear 5 to 10 days after the COVID-19. Once the first GBS symptoms to appear include weakness on the legs, tingling, and facial weakness. In a 2 days period, the symptoms worsened until all 4 limbs were weak or paralyzed, according to in Italian.
When people are sick, when their respiratory system is failing, that will have adverse effects on the brain because of poor oxygenation and other metabolic effects that are consequence on the brain. Those things we know as serious, but we also know that those are not direct effects of the virus on the brain itself. There are bits of information that have come out from a number of studies of looking at clinical evaluation of patients that would suggest that there is nervous system direct involvement by the virus, but the reliability of those studies is still in question. Stroke is one of the conditions that has been seemingly at higher incidence in patients who have involvement of the body by the COVID-19. And the mechanism by which stroke occurs in the brain is unclear in the circumstance. It's thought that a lot of it might just be worsening of pre-existing conditions. People who have diabetes, who have hypertension, who have other smoking history, where they have damage to the blood vessels already and are predisposed to stroke already, and now are being stressed from a respiratory perspective by this intense illness, and therefore it precipitates a stroke as a consequence of that. So that may be a more likely mechanism than that there is a specific injury to the brain blood vessels that's causing stroke. The principal things that we'll see from a neurological viewpoint will be changes in mental awareness, cognition, troubles with difficulty of interaction or ability to interact with the environment. I think again, one of our concerns is how much of this is going to be long-lasting, how much of this is just a temporary effect of metabolic disturbance. So those are very much uncertain points at this time.
What neurologists should know about COVID-19. The novel coronavirus, known as severe acute respiratory syndrome from coronavirus 2, or SARS-CoV-2, was first reported in December 2019 in Wuhan, China, as a case of unexplained treatment-resistant pneumonia. It has now become a global pandemic, with more than 350,000 confirmed cases as of March 2020, and a global mortality rate of 0.25 to 3%. SARS-CoV-2 is a novel human coronavirus, meaning it has not previously been encountered by humans, and therefore there is no humoral immunity to it. The disease caused by the virus, COVID-19, presents with severe acute respiratory distress syndrome, but can include neurologic complications for which neurologists should be aware. Among the neurologic complications, acute ischemic stroke and intracerebral hemorrhage have been reported in one recent observational cohort.
In early 2020, 214 patients with confirmed COVID-19 in Wuhan were reviewed for neurological complications. Among included patients in this cohort, those with cerebrovascular complications were older, had more severe COVID-19 symptoms, and a higher prevalence of comorbid conditions like hypertension and diabetes. Neurological symptoms were reported in one-third of these patients, with 15% of patients having reduced alertness and 20% had neuromuscular symptoms. Neurological symptoms were insidious in onset and happened without any typical presentation of COVID-19, such as a fever, coughing, or throat pain. The common neurological complaints were nonspecific. We have found that COVID-19 runs its course in two phases. During the initial 3 to 5 days, infected patients could present with nonspecific neurological symptoms. In the second phase, coughing, fever, and shortness of breath became common. Later in the course, elevated D-dimers were observed in severe cases and may serve as an indicator of multi-organ microangiopathy, pulmonary embolism, myocardial infarction, and stroke. What we have learned from our experience thus far is to remain vigilant for non-specific neurological complaints for those patients in at-risk population. Consider checking CK or D-dimer level in patients with suspected neurological presentations. Protect yourself with PPE and engage with your hospital leadership to determine the most appropriate use of actions regarding the use of MRI, CT, EEG, and other neurodiagnostic tools. In this way, we can reduce the likelihood of contaminating these resources and optimizing their use for our patients in the need for any other advanced testing.
As we continue to witness the spread of the COVID-19 pandemic, we hope to learn more about the neurologic and systemic complications of this disease. Anti-malarial agents, immunotherapies, and antivirals are being explored as potential treatments for the condition, but data are limited. The National Institutes of Health has implemented a Phase 1 clinical trial evaluating the safety of the first COVID-19 vaccine, but experts do not believe a vaccine will become commercially available for 12 to 18 months. For more information on
Pros and cons. Pros. In treatment is given in times that the severity of the disease is less and can improve the body functions such as pulmonary functions. Cons. If the person is not admitted to the hospital in the time, their symptoms can worsen and even cause death. Asia Plate in Ecuador. There are non-recorded cases or GPS associated with COVID in Ecuador, even though there are a few reported in parts of China and Italy. However, there could be cases associated with Zika, and this is a common disease in the region. Conclusion. Serious and early symptoms or GPS significantly increase of the risk of the major long-term complication. Rarely complications such as respiratory distress syndromes and heart attack can cause death. Even though COVID-19 is recently discovered virus, we can found that there are quite a few other diseases associated with it. This is thanks to people who study the virus and its consequence to make other professionals and people understand better this virus and learn to defeat it. Thank you so much for your attention.